Most people think morning back pain is caused by how they slept, but that's not always true. In fact, the reason your back hurts when you wake up can provide important clues about what's happening inside your spine. If you've ever gotten out of bed feeling stiff, sore, or like you're back aged 20 years overnight, you're not alone. Morning back pain is one of the most common complaints I hear from patients. Today, I want to explain why back pain is often worse in the morning, when it's normal, and when it may be a sign of something more serious. One of the first questions patients ask me is it normal for my back to hurt when I wake up? The answer is yes, sometimes. Many people experience temporary stiffness after lying still for several hours. The key question is whether the pain improves once you start moving around or whether it continues throughout the day. That difference can tell us a lot about what's causing the problem. One common cause of morning back pain is a disc issue. Discs in your spine act as spongy cushions between the bones. Throughout the day, gravity compresses those discs. While you sleep, they absorb fluid and rehydrate. This is called the diurnal disc hydration cycle. This means when you wake up, the discs are slightly fuller and under more pressure. If you already have a bulging or herniated disc, that increase in pressure can make your symptoms more noticeable in the morning. Another common cause is arthritis. Just like the joints in your knees, hips, joints in your spine can develop wear and tear over time. When those joints remain inactive for several hours, they often become stiff. That's why people with spinal arthritis feel worse first thing in the morning, but begin to feel better as they start moving throughout the day. Your sleeping position can also play a role. Sleeping on your stomach, using an unsupportive pillow, or sleeping on a mattress that no longer provides proper support can place additional stress on your spine. Abnormal positions during sleep can irritate the muscles, joints, discs, which leaves you feeling stiff and uncomfortable when you wake up. While occasional morning stiffness is common, there are certain warning signs that shouldn't be ignored. If your pain is getting worse, travels down your leg, causes numbness, tingling, weakness, or wakes you up at night, it's important to have it evaluated. These symptoms may indicate a more significant spinal condition that requires attention. The good news is that there are things you can do to help. Regular movement, stretching, optimal sleep positioning, and maintaining a healthy weight all reduce stress on your spine. But the most important step is identifying the actual cause of the pain rather than simply treating the symptoms. The bottom line is that morning back pain is common, but it isn't always normal. For some people, it's simply stiffness. For others, it may be arthritis, a disc problem, or poor sleeping posture. Understanding the cause is the first step toward finding the right solution. I'm your San Antonio chiropractor, Dr. Sam Pena, and if you're dealing with ongoing back pain and want to truly understand what's causing it, we'd be happy to help. Follow us for more practical spine and back pain education designed to help you move, feel, and live better.